Hello, I'm Jane Williams. Welcome to Webinar 8. This covers infection control. Country SAPHN acknowledges the traditional custodians of the lands we live and work on and pay respects to the elders, past, present and emerging. We recognise and respect the unique cultural and spiritual relationships to the land, waters and seas, which continue to be important to Aboriginal and Torres Strait Islander people today. The objectives are cold chain management, infectious waste and management control, practice infection control policy, and striving for 5. Cold chain management. Practices must make sure that all policies in place in the surgery reflect back to the 5th edition standards of the infection control by the RACGP. Cold chain management. There needs to be one person in the practice who has primary responsibility for cold chain management. This must be documented in the position description of that person. If the person having this role is the GP, then that task must also be noted in the position description. Cold chain management is the control of the vaccine refrigerator, the vaccines therein, the ordering of supplies and record keeping. Monthly notation of vaccines is required. The refrigerator must have the temperature recorded morning and night, and if there is a data logger in place, this should be downloaded regularly. Infection control policy must be practice-specific policy. Every practice must have a practice-specific infection control policy. Due to the uniqueness of each practice, the infection control policy must reflect exactly how this is managed. It must contain how infection control is managed on a daily basis in the practice. If the practice sterilises, then the process for that needs to be clearly documented and a chart available in the sterilising area. Documentation for sterilising must be clear, and it must contain how to access which package was used on which patient if the need should arise. Infectious waste. This must not be placed in ordinary rubbish bins. Bins must be clearly marked for infectious waste, and the practice will have a documented company that collects this waste on a regular basis. Spills kit. The practice must have a spills kit complete with a list of contents if it is not one purchased from a supplier. Ensure that the GPs know where the spills kit is and what it contains. Strive for 5. This is a reference book for immunisation in general practice. There should be a copy of this in the treatment room for reference. It means that the practice strives for the vaccine refrigerator temperature to be somewhere between 5 and 8 and recorded twice daily. Thank you for taking the time to join this webinar today. Country SAPHN gratefully acknowledges the financial and other support from the Australian Government Department of Health. For resources, you can email us at support@countrysapHN.com.au. Resources can also be found online at agpal.com.au and the 5th edition standards from the RACGP.